Are you struggling with perimenopausal or menopausal symptoms and are finding that you can't find relief and you can't find medication or supplementation from your OBGYN? My name is Dr. Eric Joseph. I'm the president of New Jersey Health and Wellness here in Livingston, New Jersey, and for the last 2 years we've been offering therapeutic wellness services. And I am so happy to announce that on July 17th of 2025, only 5 days ago, the Commissioner of the Food and Drug Administration had a roundtable expert panel from institutions of excellence all over the United States of America with opinions about hormone replacement therapy in perimenopausal and postmenopausal women. And what the experts are saying is everything that we believe in and what we've been offering for the last 2 years. The Women's Health Initiative was a study that was started in the 1990s. It is the largest prospective randomized study of women in the perimenopausal and menopausal age group, where there were some patients that received placebo and some patients that received conjugated equine estrogen, which is horse estrogen, Premarin. That's an old medication and it's still widely prescribed today, along with another group that received conjugated equine estrogen and medroxyprogesterone acetate, which is a progestin that's also synthetic. And what this study showed is that in the group between 50 to 59, or the youngest women in the group, had decreased cardiovascular disease, decreased dementia, decreased osteoporosis, decreased bone fracture, and decreased breast cancer. Because the focus of the study was to determine the effect of hormone replacement therapy on heart disease, the study also included an arm of women from 70 to 79. And the study was abruptly stopped in 2002, and there was a blanket statement made about the dangers of hormone replacement therapy because there was a small group of women in the 70 to 79-year-old group that developed breast cancer, and a small group of women also developed blood clots in their legs. And this is really due to the fact that if you're including women that have never had a hormone replacement treatment before, they're well advanced in osteoporosis and heart disease, and potentially they already have breast cancer if it was missed by a mammogram. So looking at the data from the perimenopause or menopause, which typically begins around age 50 to age 59, completely safe and helpful for not only for preventing breast cancer, preventing osteoporosis, preventing heart disease, and preventing dementia. But the number one complaint that women have that are suffering through the menopause and the perimenopause are hot flashes. And hot flashes are due to decreased estradiol. And hot flashes, when women experience them, it's really not good. It's not good for the brain. The brain actually gets too hot. And this can absolutely positively be prevented with adequate hormone replacement therapy in the right person when necessary. The other common complaint that women have as they go through the perimenopause and menopause is vaginal dryness and painful intercourse. These two symptoms are also extremely well treated with either systemic estradiol or with topical estradiol cream that has zero absorption into the bloodstream. And so these panelists were begging the Food and Drug Administration, please remove the warning label from the cream at the very least, since there is no systemic absorption, so it's impossible to have any systemic side effects. And topical estradiol cream can be extremely helpful for women that are suffering with vaginal dryness, vaginal irritation, and painful intercourse. The other exciting hormone that's here and now in the year 2025 for women is testosterone. A woman's testosterone level plummets by 50% between age 20 to age 40. And that's due to a precipitous drop-off of the production of testosterone by the adrenal glands. So in women, testosterone is produced by both the adrenal glands and by the ovaries. So the adrenal gland production from age 20 to age 40 plummets. Low levels of testosterone in women can often present as anxiety, insomnia, agitation, loss of skeletal muscle mass, inability to have strength and to get a good workout, and just difficulty losing weight overall. Testosterone increases skeletal muscle mass and decreases body fat percentage in everybody. And the worst thing that could possibly happen with a testosterone supplementation in a woman is unwanted hair growth or acne, or if there's a history of male pattern baldness, there can be some hair loss on the top of the head. No possible association at all with breast cancer, dementia. As a matter of fact, testosterone is the best bone builder, best at preventing osteoporosis. Estradiol preserves bone, testosterone builds bone, it builds skeletal muscle mass, and it's also terrific for restoring a woman's libido if that's low, and it's also excellent for reducing anxiety, and largely is the reason why so many women who are in the perimenopausal period will start an antidepressant or an SSRI, which in our experience may be largely unnecessary. I hope that you found this content interesting, and I would encourage every woman to click on the link for this video because I found it just amazing. Thank you very much.